Dr. Linda Bluestein, everybody, as I mentioned, expert in hypermobility and former dancer. So Linda, I would love to hear about your path and how you became to want to specialize in this topic that, or I shouldn't say this topic, but this area, this specialty that, in my opinion, just doesn't get enough airtime, especially in the dance world.
Wanting to be a ballet dancer, that was my dream. And when my body had other ideas, I decided to go into medicine. And that worked out well for a while until my body started to tell me, maybe you need to make another change. So plan C or D, if you will, was actually to do pain management for symptomatic joint hypermobility. I never planned on doing that. It kind of was accidental. I started figuring out how to get myself feeling better. And then I had all kinds of people messaging me because I'd written a journal article about it, and I had people messaging me, where can I come see you? So I ultimately opened a practice focusing on joint hypermobility and symptomatic management, especially surrounding pain. And all of a sudden it dawned on me, wait, my love of ballet, my love of dance, my love of dancers and wanting to support them in any possible way, and recognizing that sports medicine has come so much farther than dance medicine. Obviously dance medicine, we're doing amazing things and we have so much to offer to dancers. But I feel like most dancers and dance educators, they're not aware of what we can do for their dancers to keep them in the studio and keep them on stage. So I realized, wait, I can meld my two loves, my love of dance and my love of science, and I can bring this information to people at an earlier stage and hopefully prevent them from ever needing my services.
Absolutely. And so much of that path parallels both mine and then I know all of our fellow dance medicine professionals who you and I work with and collaborate with. It all looks the same, like our love for dance, our love for science, and really wanting to fuse this in a way that is meant to support dancers and just get them to dancing more sustainably for longer periods, to not experiencing either, in your realm, especially, and we'll talk a little bit more about this, these unknowing experiences of pain and other comorbidity or types of issues that might fall alongside hypermobility. I myself am a fellow hypermobile dancer. So this conversation, similar to, it sounds like for you, you had a personal experience with this and you're able to bring that into your practice, which is so truly so incredible. So hypermobility related disorders for so many dancers can present a lot of limiting experiences for them. But for many dancers, what I found just over my years as a dietitian is that some dancers just don't really know much about these disorders. Can you chat a little bit more about some of the challenges that you see as a clinician that are often tied back to hypermobility and related disorders that dancers could be experiencing and unknowingly?
That's just it. Oftentimes when the pieces are put together, that's when you can start to come up with a plan to, like you said, have a more sustainable dance experience, whether it's your professional career or you're dancing for fun. The whole goal is to be able to do these active things for as long as possible. So backing up to joint hypermobility. Joint hypermobility means greater than expected range of motion of a joint or a group of joints. And a joint can be hypermobile, meaning that, again, the range of motion. It can be also unstable, where there's increased accessory movement of the joint, or it can feel like it's unstable. If it feels like it's unstable, that's called functional instability. If it's actually unstable and we can measure more motion than there's supposed to be, then that's mechanical instability. And if a joint is unstable, that can put you at risk for subluxations or dislocations. And subluxation is a partial dislocation. We all only know what our own body feels like. So, we don't realize that we're basically, if we are subject to these things, we don't realize that every time we're taking a costume on and off, we're basically subluxing our shoulder, or we're doing all kinds of crazy things with our hips. I work with a New York City ballet dancer, and she's like, oh, I think I'm probably dislocating my hip every time I do a grand battement. I'm like, you might be, so we don't realize that other people don't necessarily do these things because we don't know what their bodies feel like. We just know what ours feel like. And I feel like in dance especially, what's tricky is we, of course, it's natural. We compare ourselves to everyone else in the room, right? Most people in the room are also pretty bendy. They're somewhere on the spectrum. And it's not necessarily who's the bendiest that has the most problems. You can have some degree of joint hypermobility, but because of the reason why you have it, you might have more problems than someone else who by objective measures has more joint hypermobility. So there's a lot of nuances to it. And if you have things like fatigue, poor proprioception, if you have these joint subluxations, dislocations, you feel like your joints are kind of not really staying in place even under low force conditions, that's a really important clue. If you feel like you get soft tissue injuries really easily, and especially if they don't seem like they heal in the normal time frame, that's an important clue. A lot of times people will have anxiety that can be related either to, it can be related to so many factors that coexist, right? It can be related to the not knowing where your joints are in space. That's kind of anxiety provoking, not knowing where your body is in space. Dysautonomia or dysfunction of the autonomic nervous system, that is very tightly correlated with anxiety. And we also know that hypermobility and neurodivergency are also very tightly linked, or there's a lot of science suggesting that they are linked. And we know that anxiety is related to neurodivergency. So we have lots of reasons why people with joint hypermobility might be experiencing anxiety. Disordered sleep is another one. Fatigue is, I think, like that's probably amongst my patients, probably pain is number one and fatigue, I would say, is number two. Like fatigue is such a huge thing. And so many people, they're still dancing, but they're just exhausted. And of course, if you're dancing at a really high level, you are going to be tired, right? But it's all a degree, right? And how is it the appropriate amount of fatigue, or are you experiencing more fatigue than you should? And there's a lot of low-hanging fruit that's the thing that really makes me get out of bed in the morning, is like so few people, I feel like, know about the low-hanging fruit. And they go to the doctor and they're told there's nothing wrong with you, you're fine, go away and live your life. And especially if, let's say, they do labs and they do imaging and those are okay, and nobody really addresses the function of the gut, their nutritional status, all of these other things that are extremely important. And, you know, like I love the work that you do with the relationship with food. So important. And so I think it's, you know, we have to start looking at the entire person.
There's this major level of frustration that is often experienced, especially with complex and chronic medical conditions, in seeking diagnosis. And this is what I really wanted to ask about next, because again, just in my years of working as a dietitian for dancers, the frustration of not having clarity in the various experiences that one might have, rather than either being dismissed because labs look good, or being dismissed because, oh, you're a dancer, you're dancing X amount of hours a week, it makes sense that you're fatigued. Or, this is the one that also gets me, you know, a pain scale as an example.
I hate those pain scales.
Right? You know what I'm gonna say. You know, a doctor's 10 is not necessarily the same as a dancer's 10 on the pain scale, and just all of these miscommunications and confusions and this overall just lag of knowledge surrounding hypermobility, which is really why I wanted to, you know, take this month as Awareness Month, educate my followers, educate myself, and utilize resources like yours. Talk to us a little bit more about diagnosis, about what dancers should consider.
There's a lot of things to consider when seeking a diagnosis. At the end of the day, we have no FDA-approved treatments for either hypermobility spectrum disorders or the Ehlers-Danlos syndromes, which are basically the two kind of most common bucket categories if we look at symptomatic joint hypermobility as the overarching umbrella. Underneath that umbrella, there's lots of conditions, but those are kind of the two biggest, with the Ehlers-Danlos syndromes being a group of connective tissue disorders, of which there are 14 subtypes, and then hypermobility spectrum disorders being kind of the default diagnosis. You have symptomatic joint hypermobility. It's not explained by any of the Ehlers-Danlos syndromes, and it's also not explained by osteogenesis imperfecta, Marfan syndrome, Stickler's syndrome, Louis-Dietz syndrome, any of these other like genetic disorders. But, you know, I see dancers sometimes. I was doing teaching a course the other day, and I needed a model. So it was a paid modeling position. And this young dancer had applied for the position, and she was lovely. And mom is a dance teacher. This young lady is 16 years old. She's a retired dancer at 16, retired because of her pain. And it was fascinating because I'm asking her to do some of these different maneuvers, and she bends back her fifth finger and it literally touches the back of her hand. And she's super Gumby, right? She's won all kinds of awards in dance, in competition dance. She's won awards. She won a No Bones award. She won a Gumby award. And she was always in the competition dance team, the one in the center, doing all the things, right? And even mom, as a dance teacher, like didn't know, So now, but in the meantime, she started having issues, got a lab test, and she has something that could be proven by a lab test. But they still, because of the doubt in the healthcare system, it's not that they had doubt, but after I recorded this session with them and all of these little clips that we did, afterwards they said, oh my gosh, this was so validating, because you have all these experiences again and again that you're told that you're, or you're led to believe because of how they treat you, that you're lazy or crazy or whatever. So a diagnosis can be really validating for you, because we gaslight ourselves. I've done it. I've gaslit myself. I don't know about you, Rachel, but I have gaslit myself. I've been gaslit by my colleagues. Like running out of the room in tears, and sometimes in front of my other colleagues, like in the doctor's lounge, a colleague yelling at me and saying, there's nothing wrong with your knee. I looked inside your knee. It's like, and you just like shrivel up, like it's awful, right? I mean, so many of us have had these experiences. So a diagnosis can be really validating and can help our families to understand what it is that we're going through. And I know we're going to talk about resources in a little bit, but there's an article that I was quoted in on CNN, and probably most people have heard of it. But the article is titled something like "Millions of people have this bendy body condition. Why aren't more doctors paying attention?" And I've had so many people say that they read that article and it was so validating because they could see themselves in the article, and they shared it with their family and their friends. And so, that's something that I would recommend that people check out. I would also recommend people listen to episode 42 of my podcast, the Bendy Bodies podcast, Bendy Bodies with the Hypermobility MD. We're on all the major platforms. I co-host this podcast with Jennifer Milner, who is one of our amazing dance medicine colleagues. And that episode is entitled Pursuing a Diagnosis. And so in that episode, we talk a lot about what are the pros and cons, what are the things to consider. At the end of the day, it's really about symptom management. And I just saw patients this past Saturday in person, like an intake of new patients. And, when I talk to them about, okay, this is what I think's going on. Do you want me to put this diagnosis on your chart? Here's some pros, here's some cons. And I explained to them, at the end of the day, we're going to treat your symptoms. It's really all about treating your symptoms, and the treatment isn't really going to change whether I say that you have HSD or hypermobile EDS. Now, if you have vascular EDS, that's a different story. There is different treatment for that. But it's really this, for most people, it's what are the most bothersome symptoms for you currently. And so I want to know, like, is it fatigue? Is it that you can't get through a day of rehearsals, class, without just being that bone tired? And especially if you used to be able to do those things, then we need to look at things like your nutrition, your micronutrients. Are you getting in enough calories and all the things that you need? I grew up being so weight conscious, like so many of us, you're in a leotard all day and you're like, and so being very, probably overly restrictive with my eating. And now that I understand why food is so important and what we need from our food, but that it's not just what we eat, but what we eat and absorb, right? So, it's the whole person that we need to really be thinking about. So that was a very long answer to your questions.
No, it was fabulous, so insightful. And throughout your talking, I wanted to say, that's where my work as a dietitian and my fellow dance dietitians often come in regard to this idea of symptom management and supporting dancers and helping them to identify foods that feel supportive of them in regards to whether they're experiencing GI distress, if they struggle with their body attunement, hunger cues, fullness cues. But also what we see, and this is what I really focused on in my recent blog post, was the intersection of wellness culture when it comes to chronic medical conditions and the susceptibility that dancers will then face because they'll experience, let's just say, some GI symptoms, right? They look on Google, how do I help this? And what we often see is this mistaking, I should say painstaking recommendations of, as just one example, elimination type diets, which eventually what we end up seeing actually can further worsen the same GI symptoms that's being promised to improve. So there's this huge accumulation of experiences. Also what we focused on our collaborative reel this morning in regards to why is the risk of disorder eating so much more prevalent, not only for dancers, but dancers who are experiencing such chronic health conditions. So having your resources is so incredibly helpful to this community. Now, as a dietitian, obviously I focus on the food end, but what I want to hear from you is, because you mentioned what we're looking at here, the focus isn't on wellness, it's on well-being, right? It's on the entirety of a person. What other interventions, including nutrition, are you often encouraging when it comes to symptom management?
Recently published with Victoria Daler, Courtney Gensimer, and Dr. Russell Norris. I recently published a two-part series of articles, Hope for Hypermobility, an integrative approach. And I basically outline in those articles the approach that I take to these conditions. And I use an acronym, MENS, PMMS. As a way of helping me remember it. It's an iterative process. So, I explain to people, like, we're going to start with these things, but we need to keep adapting as we go along. And, it's not going to be a linear path, but the goal is to get you functioning, and feeling as good as you can be at any given point in time, so it's really this whole approach that we take. So the first M stands for movement. So I first want people to get moving better and then moving more. Now, if you're already dancing, you're possibly moving a lot, right? But are you moving in the right way? Are you using the right muscles to execute the right movements? So working with, like Jennifer Milner, who does Pilates, especially for people who are, and a ballet coach, people who are high end, people who have a lot of joint hypermobility, working with someone like her can be phenomenal. Working with a physical therapist, of course, and especially working with advanced medicine trained physical therapists, because they understand so much more the nuances and what you're asking of your body as a dancer, right? So so things like that. So that M stands for movement, E stands for education. And I had, you always get the trolls, right? So I had somebody write, I'm always educating the doctor, and it's like, no, I'm talking about understanding the neuroscience of pain, because again, my practice is focused on pain. And I felt like for me, even I was practicing for 20 years as an anesthesiologist in the operating room, and I stumbled across a lecture on YouTube about central sensitization, and a light bulb went off, and I was like, oh my gosh, this is what's happening in my own body. So when you understand that pain and damage there's not a perfect correlation, and a dancer who's doing well, they often will tolerate too much pain, right? They'll just keep dancing through it, and they don't listen to it, and they don't rest, or relative rest or whatever. They keep going, but later on we can end up having this disconnect between how much pain we're feeling and the amount of suffering that we have. So that kind of education can be really, really helpful and can help relieve the anxiety. N stands for nutrition. I would say that I used to, in the beginning, talk more about specific nutritional things, but as I started to learn more about nutrition, I realized how little I knew. Even though I knew more than a lot of my colleagues who I never studied nutrition in medical school. So I learned most of this on my own, but I realized, wow, there's so much more that I don't know. So I do talk about nutrition a little bit, but I definitely provide a lot of referrals. And of course, you and I have another colleague, Kristen Koskinen, who works a lot with bendy bodies. And so, she does one-on-one visits, so I'll sometimes refer to her as well. So N stands for nutrition. Hugely, hugely important. I think what often happens is exactly what you described. People have they might have a lot of GI type symptoms. And then, right, they Google it, they think I need to restrict these foods. They start to get more and more anxious around meal times. And then that shuts down the function of the gut. and they start to feel less and less well surrounding food. And then they think I need to restrict more and more and more. And next thing you know, they're like eating two foods. And I've had people like that. I've had plenty of patients like that are eating like two or three foods. We want to avoid that. And in most cases, that's completely unnecessary. So, and the sooner that we catch these things, the better, right? S stands for sleep. Getting people sleeping better all by itself will help with pain levels and will help with fatigue, right? And there's a lot of different things that people can do to help improve their sleep. The P stands for psychosocial. So, when people are experiencing a lot of these types of conditions, like whether it's anxiety or disordered sleep or pain, it's important to get the right support networks. So it could be one-on-one counseling. It could be a support group that's solution focused, something like that. Let's see, P, the next M stands for modality. So it could be acupuncture, acupressure, ultrasound, all kinds of different modalities like that. And then the next M stands for medications. And then the last S stands for supplements. Medications and supplements are intentionally at the end. There's an M, there's two M's and there's one S earlier on, but sleep, movement, and modalities are more important. Most people, I feel like the most common mistake that I see is they go to the doctor, they get prescribed a medication, and they think that's going to fix the problem. And when it doesn't, both they and the doctor kind of throw up their hands like, we don't know what else to do. So I explain to people, I really think that it's this holistic approach, treating you as a whole person and taking this approach that can really be very successful.
Absolutely. And I love that. Such actionable insight for dancers who might know that they have or that they're experiencing any of these symptoms, or who might be suspecting it. And in regards to looking for that insight, looking for a diagnosis, that validation, and of course, then seeking appropriate care. So thank you so much, Linda. You have incredible resources for dancers to turn to. I'd love for you, before we wrap up, I'd love for you to share those resources.
My website, which is hypermobilitymd.com. So I definitely recommend people check that out. And then I also wrote an article for Healthy Dancer Canada, titled Understanding Hypermobility in Dancers. And so that's something that I think would be very valuable for people to read. And then my podcast is called Bendy Bodies with the Hypermobility MD. You can access that from my website and also through bendybodies.org, which will be right now they're kind of on the same site, but they're going to be separated out. So there's Hypermobility MD, which is more related to the medical services, and then bendybodies.org is the podcast.
Thank you so much. Yeah, this was so insightful, especially for every dancer that's listening, in regards to understanding the importance of symptom management, understanding where you're accessing information from, making sure that it's coming from credible sources. This is especially what we see in regards to food and nutrition. A lot of dancers hooking on to ideas that end up becoming very unsustainable and ultimately disordered, especially around elimination types of diets when it comes to symptom management. So I cannot stress this enough. Please go check out Linda's resources.
And I did want to mention, because I think I forgot to mention this earlier, dancers, we're people pleasers, a lot of us, and we're also perfectionists. And so we read these things online and we take them so literally, and we can take them to the extreme. So I think that's where it's so important to work with a knowledgeable person one-on-one, work with a registered dietitian, nutritionist, whenever possible, because they can help bring that balance into your life. Whereas you might read these things and take it to the extreme. And that's what we're trying to avoid.